Hello everybody. So this is my fifth video, and over here I'll be talking about all the cardioselective beta blockers. Now I had come up with a mnemonic to remember the names easily. So here's the mnemonic first. Be there at one's mom. So you might notice that I've written some letters in capital and some letters in small. So let us take the capital letters. B. B will stand for bisoprolol, betaxolol. E will stand for esmolol. A will stand for atenolol and acebutolol. N stand for nebivolol. C and E I'm taking together. Celiprolol. M metoprolol. Okay, of these, betaxolol, nebivolol, and celiprolol are third generation beta blockers, and the rest, bisoprolol, esmolol, atenolol, acebutolol, metoprolol, all these are second generation beta blockers. Okay, the third generation cardioselective can also be remembered by the mnemonic NBC. Okay, now let's learn a bit about their properties. First, esmolol. Now esmolol is the shortest acting beta blocker, and like I told earlier that all the shortest acting drugs are preferred in emergencies because their effects quickly disappear. So esmolol is preferred in surgery in case there is tachycardia, and it's preferred for both the treatment and prophylaxis of tachycardia. And it is also used for the treatment of SVT, that is supraventricular tachycardia. It is the shortest acting because it is metabolized by plasma esterases. Metoprolol, one of the major uses of metoprolol is in case of STEMI, that is ST segment elevation myocardial infarction, and you have to remember the dose of this one. It's a bit complicated. It is given IV 5 milligram for 3 to 5 minutes, not for, rather every 3 to 5 minutes for 3 doses, followed by an oral regimen which is 50 milligram every 6 hours for 48 hours, followed by 100 milligram every 12 hours. Now, one common use of metoprolol and bisoprolol is in congestive heart failure. If a teacher asks what are the beta blockers used in congestive heart failure, along with metoprolol and bisoprolol, please mention nebivolol and carvedilol. And you'll further learn in medicine that heart failure can be of two types, with reduced ejection fraction, thus I wrote REF, and with preserved ejection fraction. In case of reduced ejection fraction, we preferably give nebivolol, and in case of preserved ejection fraction, we give carvedilol. Next, a bit about betaxolol. I already told you that betaxolol is a third generation beta blocker. Now, what is this third generation? Third generation means they have some additional property besides their beta 1 blocking. So, obviously, they block beta 1 receptors. Along with that, they can block calcium channels. So, it is a calcium channel blocker as well. Betaxolol is commonly given for the treatment of open angle glaucoma, and normal tension glaucoma. Now I'll deal with glaucoma in a separate video because it's a large topic. I'll deal with it separately. For the time being, just remember that betaxolol is given in open angle and normal tension glaucoma. It has the primary mechanism of action of all beta blockers in case of glaucoma is decrease aqueous production. Betaxolol has the additional property of having a retinal protective effect. Okay, please remember this is commonly asked in your viva. Now a bit about nebivolol. Nebivolol is a very interesting drug. It has beta 1 blocking property. Then it causes nitric oxide release, and also it has an antioxidant property as well. Okay, so yeah, all good about nebivolol. Please remember these 3 points. Okay, beta 1 blockade, nitric oxide release, and antioxidant property. It is actually a racemic mixture. The D isomer will cause beta 1 block, and L isomer will cause the nitric oxide release. Okay. Next, a bit about celiprolol. Celiprolol is also a very interesting drug. Why? Because with beta 1, in addition to beta 1 blockade, it also has beta 2 agonism. Okay, Yeah, means it's very interesting. So that's why it can be very safely given in case of COPD and bronchial asthma, because it's dilating, bronchodilating, and also it has the property of nitric oxide release. Okay, so please remember these 3 points. It blocks beta 1, but it has a beta 2 agonistic effect and a nitric oxide releasing effect. Okay, and lastly, a bit about atenolol. Atenolol can be used for the treatment of hypertension. I discussed about it, that the beta 1 blockade, so the RAS axis will be suppressed. Also, it can be given in combination with amlodipine. So what is amlodipine? It is a dihydropyridine type of calcium channel blocker. I'll be talking about these calcium channel blockers. There are two types: dihydropyridine and non-dihydropyridine. So amlodipine is a dihydropyridine type of calcium channel blocker, which is also given in hypertension. Now, why are these two drugs given in conjunction? This is because when amlodipine blocks these calcium channels, there is vasodilatation, blood pressure will fall. Now, when blood pressure will fall, we all have learned in physiology that there will be reflex tachycardia. This is undesirable. To prevent this reflex tachycardia, we give beta blocker like atenolol. Okay, so it will decrease AV node conduction and hence the heart rate will decrease. Okay, and so just like to mention one point which I actually mentioned in my previous video as well, that is these beta 2 receptors are no longer being blocked. So these can be the beta 1 selective blockers, or the cardioselective beta blockers, can be safely given in case of diabetes mellitus, asthma, COPD, and peripheral vascular disease. Okay, so the cardioselective beta blockers do not block beta 2 receptors, they just act on the beta 1, and so all those side effects and contraindications are no longer present in this class of drugs. So I think I've covered all the points. Let me just check once again. So yeah, I've talked about bisoprolol, betaxolol, ceriprolol, esmolol, atenolol, and nebivolol. Okay, please remember this mnemonic and a few properties about these drugs. Okay, you may be given a short note about nebivolol. Okay, and also about maybe betaxolol, but other than that, these drugs are commonly asked in your Viva exam. Okay, yeah. So thank you.